Good evening, and welcome to Talking Sugar Live Chat, sponsored by Antioch Foot and Ankle Group. I'm Jackie Tomlin, and I will be your host for this evening. And with me tonight, we have Dr. Thomas Donohue. And Dr. Donohue is a here at Antioch Foot and Ankle Group. We wanted to bring some information to you, first of all, on ways not to have wound care, especially if you're a diabetic. But if, in fact, you find yourself needing those kinds of services, then Dr. Donohue is going to tell you what you need to do so that you can save your foot. As many of you know, we specialize here at Antioch Foot and Ankle Group in diabetic foot care. And Dr. Batuin, who is our podiatrist here, is a caring professional that will take care of your feet, and if you're a diabetic, give you managed care on a regular and recurring basis. Diabetes is the leading cause of blindness, toe, foot, and leg amputations. Our goal here at Antioch Foot and Ankle Group is to make sure that if you are diabetic, that you have managed care and that you do not lose any of your limbs due to your diabetic condition. So this evening, Dr. Donohue is going to talk to us, but I want to tell you that we have a distinguished person with us on the live chat tonight. He is retired military, and let's see, we went up to major in the military, is that correct? And in addition to that, he is at St. Joseph Candler, and he is doing just a fabulous job, and I want to make sure that I say this correctly, that you began in the hyperbaric medicine, and you were trained at the Palmetto Health in Richland, Columbia, South Carolina, and you're a member of the Undersea and Hyperbaric Medicine Society.
That is correct.
You're going to have to tell us all about that. But then you began working in wound care. That became your passion?
Yes, ma'am.
All right. And you've been doing that since 2006?
That is correct.
All right. And you are currently the medical director at two St. Joseph Candler centers, the one and hyperbaric and wound care centers, the one at Candler Hospital here in Savannah, and also you work out of Hinesfield. Is that correct?
That is true, too.
All right. So Dr. Donohue is well qualified to talk to us about wound care this evening. He's an experienced educator, researcher, and he is also a published author. And he lives here in Savannah with his wife and their two children.
That is correct.
Dr. Donohue, start us off by telling us the best way not to come and see you.
Well, first, I'd like to say thank you for having me. I appreciate being here tonight. And I didn't retire from the military. I spent 9 years.
9 years
in the
okay.
Army. Just want to make sure I clarify
All
that.
right.
Well, the most important thing about foot care is to do it. You have to do foot care so you don't get an ulcer and you don't end up seeing me in the wound care center. Patients that are, especially if they're diabetic, should be checking their foot and their feet every night. When I mean check their feet, I mean look between your toes, look at the bottom of your feet, look into your shoes, make sure there's not a bottle cap in there or some other foreign body that could cause an injury, because many diabetics over time end up losing nerve input to their feet and they get what's called neuropathy, where their feet, you don't feel pain as much as you should.
Can I jump in here just a second? Because we actually go out into the community and do presentations to churches and different organizations about how to live with diabetes instead of die with it. And one of the things that we say is exactly that, to take a look at your feet every day. Now, there's some people that say, oh, I can't get my foot up to look at it.
Have somebody else look at your foot.
Have somebody else look at your foot. Buy a mirror with a handle on it so that you can look at your foot. They have those slender mirrors in the store that you can just put up against a wall, bring your chair up and look at your foot. But each and every day, you must look at your foot, because we've heard stories about people having a toy inside of their shoe and not recognizing that there is an object there, because they're losing that sense of feeling in their feet.
That is correct. And so when you look at your foot every day, you can see if there's a problem. And again, like I said, also check your shoes before you put your foot in your shoes to make sure there isn't a foreign body like a toy or a bottle cap. And then finally, people that are diabetic, and especially people that are diabetic that have neuropathy, make sure that you wear some kind of rubber-soled or hard-soled slipper at all times. You should not be walking around your house on bare feet. You shouldn't go to the beach in bare feet. You need to be wearing swim shoes. I'll give you that. When you take a shower, you can be barefooted. But other than that, you should be wearing something on your feet at all times.
And Dr. Donohue, can you tell our listeners what is neuropathy?
Neuropathy is when you lose the normal nerve input to your foot. The nerves don't work well, and so your foot could be numb. It could be completely insensate, which means you feel nothing at all. But you just don't know that. A lot of people don't even know they don't feel well. They think they feel something, but actually, when your podiatrist, like Dr. Ben, or your primary care doctor does a test on your foot to see how well you feel, there's a thing called a Simpson-Weinstein test. We take, essentially, it looks like fishing line, like a kind of a stiffer fishing line, and they actually test the bottom of your foot to see how well you feel.
And when you come to the office, especially on your first visit, we test for all of those things. We're going to test to see what kind of feeling that you have in your foot. And we're going to take an x-ray of your foot. We're going to do all of those things. And then we're going to see you back about every 62 days, because your insurance, that's Medicare, Medicaid, and most private insurances, will pay for you to have your toenails clipped every 62 days. So why should you be struggling or have someone that is not a professional cutting your toenails, and they might nick you, which could ultimately cause a wound, when you can have somebody that is a professional, your foot is eye level with them, and they're cutting your toenails. It just makes sense.
It does make sense. And along those lines, you also want to make sure you keep your foot hydrated, for especially those people that are insensate or have the neuropathy. A lot of times they get dry, flaky skin, and dry, flaky skin will also break down and cause wounds. So if you stay hydrated using a good lotion, that also will keep your skin more pliable and will keep you from getting wounds. So the most important thing is to avoid getting a wound, because then we have a big problem. Even like Ms. Tomlin said, you get a little nick from cutting your toenails. That little nick may end up become a big ulcer on your foot, or a big wound that becomes infected, and then you end up losing your toe or your foot, or even possibly your leg or more, depending on what's going on, especially in the diabetic.
And he's not just saying that. There are, Dr. Dandy, who is the founder and owner of Antioch Foot and Ankle Group, is diabetic. And if you're diabetic and you have family members that are diabetic, then you have more of a propensity to be diabetic as well. And Dr. Dandy takes diabetes, and we take it very seriously, diabetes seriously here in this office. He has lost family members to diabetes. His sister was at home and sitting in front of a space heater and fell asleep. Her daughter came in and smelled something cooking. It was his sister's foot, and she did not feel it. She ultimately had to have her leg amputated and then eventually died. And so that's a horror story, but it is very true. And you have to take care of your feet if you're diabetic.
And I actually have a patient in my practice right now who did exactly that. Her feet were cold during one of our colder weeks, which are very rare down here, but we do have them.
Yes, we do.
And she had her foot near the space heater, and she ended up burning her toes. So again, people with neuropathy, you don't need to do that. You need to keep your feet away from the heaters because you don't
Exactly.
feel the heat like you would normally would before when you were a younger person, or how your hand would feel. And so it's easily burned, and then we have to deal with that. So if you're diabetic, about 25% of all diabetics across this country will end up with a diabetic foot ulcer at some point in their life. So if you're diabetic, you have 1 in 4 chances of getting an ulcer. And what's important about that is once you get an ulcer, about 15% of those ulcers go on to end up with an amputation. So 25% of people are going to get an ulcer if you're diabetic, and 15% of those are going to go on to get an amputation.
That's high. Is it because those numbers are high, in my opinion? Why is it that so many are getting an amputation? Is it because of lack of information, that people are not educated on what diabetes can do? Why do you think it is?
I think it's a combination of a few things. The point is not to get the wound like we already talked about. The marker of an ulcer is just a marker of the disease. So once you get an ulcer, that tells us that you probably don't have good feeling in your feet. Your feet may be misaligned because you don't have that nerve input, so that nice pretty foot starts to fall apart. There's a thing called a Charcot foot, which a lot of diabetics get, and people that don't have nerve input their foot get, because you don't have the normal sensation, so the bones fall apart a little bit. That can cause malpositioning and different kind of pressure points. Also, people that are diabetic tend to have other disease processes going on.
Yeah.
They tend to have vascular disease, so their arteries may not work as well in their legs, so you don't have the blood flow you need to keep yourself healthy. They may have renal failure from their diabetes, and that in and of itself causes people to be more at risk for wounds and more at risk for non-healing. Also, it's all about sugar control. If their sugars are not under control, it's easy to get wounds. It's hard to heal wounds. It's easy to get infections if you have a wound, or easy to get infections anywhere in your body, and it's hard to treat those infections. So in the wound care center realm, I like to tell patients they need to keep their sugars under 160 all the time, morning, noon, night. If it's above 160, you're setting yourself up for failure with diabetes. Your primary care doctor or your endocrinologist probably wants you much tighter than that, probably wants you around 100 to 110, 120, because they were trying to avoid the blindness she talked about, the kidney failure she talked about, the other disease processes that the diabetes can cause.
Even heart failure or stroke.
That's right, because the heart failure, the heart disease, and the stroke is just another vascular problem. If you have vascular problems in your heart, or if you've had a stroke, you may have vascular problems in your legs too. It's not just isolated to the one organ system. It could be anywhere. So from my perspective as a wound care physician, I want to see it always under 160. Your doctor's going to want it even tighter.
You said that a person with diabetes oftentimes might have Charcot foot. What is that?
Charcot foot is a foot deformity that the normal contour of the foot is lost. People that get Charcot foot are, again, from neuropathy. It's just the nerve input. You lose your nerve input to your foot, so your muscles and everything don't feel normal, so you start losing the normal contour of the foot. A lot of people with Charcot foot get foot angulation. They get a banana boat look to their foot, where their foot starts to curve down versus have the nice curve up, and all the bones start to move around, and so you get different pressure points, which makes you more susceptible to get an ulcer. Your podiatrist and the foot and ankle surgeons are the people that will deal with this and try to keep that from happening. And if you do get that, you need to end up seeing a podiatrist or a foot and ankle surgeon down the road possibly, and you may need foot realignment surgeries or bone shavings to try to get things more anatomically correct so they don't cause an ulcer down the road.
And we talked about people's feet being bunched up, and a lot of times just the friction of your shoes. If the shoes are too tight, and a lot of times we have those pointed toe shoes, they can cause you to get an ulcer eventually. And one of the things that we always tell our patients is that Medicare, Medicaid, and most insurances will pay for you to have a pair of diabetic shoes once a year.
And usually, I believe, 3 sets of inserts.
Oh, and
So-
that's what we recommend is those inserts. But, people say, well, and diabetic shoes used to be they looked awful. But that's not the case anymore. They have some good looking shoes. But the reason that you need them is people say, well, I don't need them. Yes, you do. Because the toe box is wider on a diabetic shoe. So it's not going to cramp your toes in like this. You're going to have room in that shoe. And we work with your primary care physician to get those shoes for you. And so, if they're free with your insurance, then why wouldn't you take advantage of that and the many styles that we have to offer?
And that is correct. And you can't just come in and say, I'm diabetic, I want a pair of shoes. You got to have some
Exactly.
problem. You have to have some neuropathy. You got to have some bony changes, some Charcot changes. Something has to be there to show that your foot is at risk. If you're an 18-year-old diabetic and you still have great feeling in your feet and your foot's normal looking, no one's going to pay for a pair of shoes for you.
No, but that's why we work with the primary care physician. It has to be in their notes at least 6 months.
Right. So we need to make sure that you qualify for them, and I think they are important. We frequently see patients that come into the wound care center that have had wounds on their feet for weeks and or months, and no one has ever given them a pair of shoes to wear to get them to what's called offload. You want to get the pressure off the foot to offload the foot so it can heal. Diabetic shoes and inserts they don't treat ulcers, they prevent ulcers. And so the goal is to get a good pair of shoes and a good pair of inserts, and then you still have to watch your feet. You need to look for if maybe you're starting to rub at a different spot, or maybe the shoe's a little tight over here. You may have to go back to either your podiatrist or the orthotist, whoever gave you your shoes, and they may have to adjust your shoes or inserts on a few different occasions to get them just right. And then every few months, they may have to adjust them again. That's okay because your foot is going to keep changing over time. Nothing stays the same.
I was at Senior Citizens community talking about diabetes not long ago, and they said, well, we have somebody that just comes, and they want to know our size, and that's how we get them. Beware of shoe peddlers coming to your door and selling you a diabetic shoes. As Dr. Donohue said, you don't say, I need a size 9 and get a pair of diabetic shoes. You're going to come in, we're going to measure your foot, we're going to take a look at your gait, we're going to do an analysis of your foot, and that shoe is going to be ordered and the insoles are going to be ordered. Sometimes we have to have the insole even made, but those shoes are going to be for you, not a typical size 9.
Correct. And if you have your shoes and you're getting good care, again, you'll hopefully never see me. But if you do get a wound, a lot of the podiatrists and the foot and ankle surgeons will take care of wounds for a while. And if they can't get them to heal, they end up referring them to the wound care center. And the reason that is the wound care center specializes in taking care of all types of wounds, not just diabetic wounds, but all types of wounds. And we tend to have the latest therapies, all the different types of dressings that you can put on wounds. There's lots of different kinds of dressings, from the old school honey dressings all the way up to different kind of living tissue therapies that we can use on diabetic
Oh, you have
ulcers.
to tell us about that now.
Yeah.
How do you use a living tissue to treat a wound?
So if you have a diabetic foot ulcer and you're getting good care, which means we've looked at your blood flow, we're making sure your foot is offloaded, so we're addressing the pressure point, making sure it's not infected, and doing wound care. And after 30 days, if it hasn't significantly healed, most insurances and Medicare will allow us to do what's called advanced skin therapy, which we can do a different variety of things to help heal the wound. They have circumcision skin products, amniotic membrane products, placental membrane products, pig gut, sheep gut,
Really?
all different kinds of products that we can use that we lay into the wound, it melts into the wound, and it seeds that wound with collagen, proteins, and enzymes to help your body heal it. Because your body obviously is not doing what it needs to do to heal the wound, so we're going to kind of give you some extra proteins and enzymes to help you heal.
Jumpstart the healing.
Correct.
Boy, that is amazing. Technology and the treatment of wound care has advanced exponentially
Right.
over the years. It really has. Does a person have to be referred to the wound care center for them to be treated? Do they come through their primary care physician? How would a person that believes that they have a wound come to see you?
So most wound care centers across the country, and there are a lot of them, most hospitals have wound care centers associated with them, and there's actually some private ones too. Most do not require a referral unless your insurance requires a primary care referral. You can call up on your own if you have a wound, and most wound care centers will get you in and see you. I'd say the vast majority of wound care center patients still come through a referral source from their primary care doctor, the ER, the podiatrist, the surgeon. However, you don't need a referral. So your repeat offenders usually just call us because they already know we're there. New patients, a lot of times, they don't know we're there until they come through their primary care doctor. But you do not need a referral. Having said that, most wounds should heal within about 2 weeks. If you're outside working in the yard,
That was my next question.
you get a
What's
cut.
normal?
Yeah, you get a cut, and it usually heals within 2 weeks. If you have a surgery, the surgeon usually takes out your staples or sutures in about 2 weeks. So most wounds should heal up within about 2 weeks. So if you just get a routine random injury, it should heal in about 2 weeks. If it doesn't, then you need to seek out special care. And obviously on the initial event, you need to get seen by the urgent care doctor, the ER, someone to take care of your wound if you don't feel comfortable doing it yourself. So at least you get some care immediately, and then you can decide if you need further care. Obviously, big wounds, deep wounds, infected wounds, or wounds that are not healing should be referred to the wound care center.
What is the home remedy that you most typically see a person come in that didn't work?
I wouldn't say there's one that's more common than others. However, I will review some of them for you.
Okay.
I've seen turpentine. That doesn't work. Dog licking. That doesn't work.
My.
Peanut butter. That doesn't work.
Are you serious that
Peanut butter.
No.
Putting peanut butter on the
Dr.
wound.
Donahue.
That doesn't work.
Yeah, we want you to be truthful on this.
I am being truthful. Honey bear honey. So honey, honey's been around, for thousands of years. The Egyptians used to use honey.
Okay.
Honey, it definitely has a proven role in healing wounds. It's antibacterial. It keeps the wound moist. It has a little bit of acidity, so it helps debride the wound by allowing moisture to get in and your body to naturally push off debris out of the wound. However, you shouldn't be using, over-the-counter honey bear honey or the local honey, because that's not been purified. So if you're going to use honey, you at least need to use medical grade honey.
I see.
And it has a role. It's not the best treatment out there, but it does work. So you will see people that come in